Join UNICEF as an immunization specialist in Cotonou, Benin. As an immunization specialist at UNICEF in Cotonou, Benin, you will have the opportunity to lead strategic, high-impact work to improve child health outcomes through immunization programs. This position, classified as the P3 level, is designed for professionals with mid-level experience in public health, specifically within immunization and health systems. UNICEF, a global leader in children's rights and well-being, works in over 190 countries and territories, making it a powerful platform to contribute to sustainable health improvements. Benin, with ongoing efforts to strengthen its health infrastructure, presents an exciting setting for impactful work in immunization coverage. The position combines both technical and professionals passionate about making a difference in global health. This is an ideal role to apply your expertise meaningfully. The immunization specialist role is vital because it directly impacts the lives of children by reducing vaccine-preventable diseases, which remain a leading cause of death in low-income countries. According to the World Health Organization, immunization prevents 3.5 to 5 million deaths annually and is one of the most cost-effective public health interventions. In regions like West Africa, including Benin, expanding immunization coverage is crucial to meeting global targets such as those outlined in the Immunization Agenda 2030. This role not only strengthens routine immunization, but also enhances community trust and health system resilience through outreach, training, and integrated health campaigns. By working with UNICEF, you will be positioned at the intersection of policy, strategy, and fieldwork, empowering you to address gaps in equity and access. This job matters because every child has a right to live a healthy life, and vaccines are a key part of that promise. The immunization specialist will be responsible for designing, implementing, and monitoring immunization strategies to ensure effective service delivery in collaboration with government ministries and international partners. This includes leading technical assessments, evaluating coverage and dropout rates, and identifying gaps in cold chain logistics and community outreach. Moreover, the specialist is expected to build capacity among local health workers through training, supervision, and performance reviews, aligning with the goals of the Global Vaccine Action Plan. Another critical component of the role is monitoring program performance using data tools like DHIS2 and supporting the timely procurement and supply of vaccines. This work requires a systems thinking approach and an ability to integrate immunization efforts into broader maternal and child health frameworks. Ultimately, the goal is to promote equity by ensuring that vulnerable and underserved populations receive consistent, high-quality immunization services. This position requires an advanced degree in public health, epidemiology, or a related field, along with at least 5 years of relevant work experience in immunization or health systems. Practical field experience in program planning, monitoring, and evaluation, especially in resource-limited or developing country settings, is highly valued. Proficiency in both English and French is essential for effective communication with local and international stakeholders in Benin, a francophone country. Familiarity with UNICEF's operational and reporting frameworks is a plus but not mandatory. Candidates should demonstrate a strong understanding of global immunization policies, such as the Expanded Program on Immunization and IA 2030. Additionally, skills in data interpretation, budgeting, and cross-cultural teamwork are necessary for success in this complex, multifaceted role. The ideal candidate will not only be technically competent, but also adaptable, strategic, and committed to health equity. In this role, the immunization specialist collaborates with global and regional partners such as the World Health Organization, Gavi, CDC, and National Health Ministries. These partnerships are essential for aligning country strategies with international best practices and securing technical and financial support. For example, joint planning with the World Health Organization and Gavi ensures that Benin's immunization efforts are consistent with IA 2030 goals and Sustainable Development Goal 3, good health and well-being. Effective coordination also enhances supply chain management, surveillance systems, and emergency response capacities. The specialist plays a key role in facilitating knowledge exchange through technical working groups and national immunization committees, fostering a shared vision of health equity. This collaboration not only improves vaccination coverage, but also strengthens health systems by building national ownership and capacity. By joining UNICEF, professionals gain access to a rich network of expertise and resources that multiply your impact. The immunization specialist position is not only an opportunity to improve child health, but also a chance for personal and professional development. Working with UNICEF provides access to high-quality training, mentorship, and international mobility opportunities. The role allows specialists to build leadership skills, gain experience in cross-sectoral collaboration, and manage multi-million-dollar programs. Moreover, the impact of this work is both immediate and long-term, improving survival rates, boosting community health literacy, and laying the foundation for lifelong wellness. In Benin, where access to healthcare can be limited in rural areas, the difference made by effective immunization strategies is significant. For public health professionals seeking meaningful, measurable outcomes and a career trajectory that aligns with global health leadership, this position offers exceptional growth. It's a role where you don't just manage programs, you save lives. As an immunization specialist with UNICEF, each day is structured yet dynamic, reflecting the complexity and impact of the role. The morning typically begins with coordination meetings alongside local health officials to align on community outreach strategies, assess supply chain logistics, and review progress on vaccine distribution. By midday, the focus shifts to field visits, monitoring vaccination sites, observing service delivery quality, and addressing any barriers to access or uptake. In the afternoon, time is devoted to analyzing real-time data on immunization coverage, identifying gaps, and adapting program strategies to improve efficiency and equity. Finally, the day ends with strategic planning sessions for upcoming campaigns, often in collaboration with national and international stakeholders. This rhythm highlights the blend of operational leadership, data-driven decision-making, and field engagement that defines this critical role. It's a job that balances technical rigor with hands-on public health impact. To apply for this impactful role, visit the official UNICEF careers page and search for Immunization Specialist P3, Cotonou, Benin. Make sure your application highlights your technical experience, language skills, and commitment to global health equity. Tailor your CV and cover letter to emphasize relevant achievements such as successful project management, community engagement, or strategic partnerships. Applications are reviewed on a rolling basis, so early submission is encouraged. If shortlisted, candidates may undergo assessments and panel interviews focused on problem-solving, collaboration, and technical expertise. For questions, contact UNICEF recruitment team through the job portal or if you refer to the FAQs provided on their website. This is more than a job. It's a mission to protect every child's right to health. Don't miss your chance to be a part of something bigger than yourself. And here we have our APA reference list with 8 delightful references that are all completely listed. Thank you so much for joining me, and thank you for a great semester.